Hello and welcome everyone. My name is Helia Mohammadi. I'm Chief AI and Precision Health Officer with our Health and Life Sciences worldwide team at Microsoft. Today I have the privilege of having Evan Lyons from Peterborough Regional Health Centre. Can you start by introducing yourself and your role at PRHC, Evan?
Absolutely, and thank you so much for having me today. My name is Evan Lyons, and I'm the VP Digital and Chief Information Officer here at the Peterborough Regional Health Centre.
Wonderful. Let's start by sharing your perspective on how the deployment of cutting-edge technologies like Fabric and AI-based tools is transforming healthcare delivery at PRHC.
I think for us, we've really leaned into the idea that these aren't optional. For us to continue to sort of expand and scale as we need to with the demand that's coming into the hospital, these tools really have become table stakes for us. And when you look at the scattering of data that you find in a healthcare setting, one of the most important pieces to us is being able to get it into one place for analysis and AI training purposes. So for us, tools like Fabric and the associated AI libraries that are within Fabric have allowed us to not only sort of collect, cleanse, and standardize our data, but also start to analyze it in ways that historically we just weren't able to.
This is great to hear. As both of us know, security and privacy is a major challenge and a very important, especially in the healthcare space. What are some of the biggest security challenges PRHC has faced in protecting patient data?
So for us at PRHC, this one is twofold. It's both the cybersecurity component, but also the data governance component. So when we look at it from the side of cybersecurity, obviously we're seeing increasingly complex cyber attacks on institutions like hospitals and other healthcare affiliated organizations. So therefore, we're taking significant steps to secure our data estate in our Azure environment and ensure that we're delivering it both in a latent way so that it's performant and people can use it, but really prioritizing that it's secure. On the data governance side, we're really focused on ensuring that individuals only see the information that they need to do their job, and that we manage the access controls appropriately so that we can retroactively be looking at who's accessing and utilizing data, but also setting alerts around who might be trying to access data. It's not necessarily just a concern around nefarious utilization of data, but also ensuring that personal health information is really only used for the purposes of advancing and improving patient care and patient outcomes.
Thank you so much for sharing that. And I know there are several challenges in addition to security that are unique to the Canadian healthcare system. How has AI helped address these challenges that are unique to Canadian health systems, such as resource allocation, patient accessibility, or staff workload management?
So this really ties to the original point around it not being an option to adapt the way that we're doing things. Really, I firmly believe that the current landscape in healthcare isn't one that you can buy your way out of. This challenge is here to stay, and the challenge itself has changed over time. And we found that the historical approaches to problem solving aren't going to work simply because the problem that we're trying to solve has evolved. So one of the key components in terms of being able to utilize AI to address these issues is how we can do this extensively and scalably while being cost effective. So one of the areas that we have a lot of focus in our data and AI programs is looking at strategic allocation of resources within the hospital, ensuring that we're meeting the demand not only where it is, but where our predictive markers are showing us where it will be. For us, being reactive is not only harming patient care, but it's also more expensive patient care. So we're looking at optimizing our resource allocation before we get to the point of allocating them. I think one of the other advantages that it provides us is that it opens the digital side of care provisioning, in the sense that we can't continuously increase the size and footprint of hospitals. It's just not financially sustainable. And from an infrastructure perspective, it's not the direction that we see things going. What we really want to look at is how do we utilize acute care resources in the hospital setting as efficiently as possible and look to reroute care methodologies where safe and effective to allow for us to digitally extend the services of the hospital to where patients are, not necessarily necessitating patients coming to the hospital itself. So I think for us, looking at now that we have all of the data centralized through a service like Fabric, we've been able to pull it together and start to study it in ways that we historically hadn't been able to. So there was a lot of point solutioning that you would see in healthcare, and not just here, but pervasively across the system, because it was really difficult to paint that full picture that you need and to establish robust enough data sets to actually train models in a way that's sophisticated enough to make an impact. So really kind of thinking about it from that patient journey perspective, from the initial, someone presenting at the hospital through diagnosis and then into a customized treatment plan, we're looking at collecting the data point by point, and then starting to thread that together to be more predictive for future care pathways. What this is really allowing us to do is move beyond just clinical interpretation and clinical notes in our EMR and actually get to the point where we're drawing in data, things like IoT or IOMT, and being able to have those data points at our fingertips to start to identify risk markers, to start to identify consistent patterns that we've seen before. Ideally, we're allowing our clinicians to not spend their time re-diagnosing or re-evaluating content that's been done thousands of times before. If all the markers are consistent, our data products should really be showing them directionally that this seems to be in alignment with a pattern that we've seen before. This then allows for those resources to spend more of their time on complex issues that they haven't seen before, and allow for us to allocate resources to the patients of the most extreme need. I think in the healthcare setting, we obviously want to ensure that every patient is being cared for, but we also need to responsibly manage those assets and ensure that patients in the highest or most dire need of care are receiving the amount of care correlating to their need. I think one of the other, exciting pieces around care delivery is that we can get to much higher degrees of customization in the care patterns that we're providing to staff, because we're not just following sort of standardized diagnosis pathways. We're actually informing with data throughout to be able to reinforce those clinical decisions. The data and the AI sort of solutions around it will never replace the expertise of the clinician, but in the most ideal setting, they'll augment them to be allowed to focus on solving complex problems that live outside of the standardized patterns.
You touched on so many great points, and one of them that kind of stood out for me is breaking data silos. Not only breaking the data silos, but also bringing other types of data sets that are surrounding the patients in order to have a 360 view to provide better care for the patients, and also supporting your care team. We've been partnering together for a long time, and I'm really excited to learn what role has Microsoft played in enabling PRHC to advance its AI capabilities and also innovate in the health delivery.
I think first and foremost, Microsoft is a paramount partner in everything that we've been able to do here. Really, the way that I characterize this most frequently is that Microsoft has allowed us to go much further and faster than we would have on our own. I think not only by provisioning technology that is so healthcare specific, and it's very exciting to see the amount of work on the Microsoft side that's gone into creating products that are reflective of the environments that they serve. So some of the out-of-the-box solutions that are available from a healthcare provisioning perspective have been incredibly helpful to allow our teams to accelerate, but then all the way back to the security and core infrastructure that's actually enabling the day-to-day work that we're doing. We don't get any of this off the ground without those tools and solutions in play. I think one of the other important factors in this relationship has been the support and encouragement to adopt some of these technologies more aggressively. We've been fortunate in the sense where we've been amongst the first in Canada to be able to deploy things like Microsoft Fabric and Microsoft's AVD and AVS solutions as examples to allow us to centralize a lot of our compute, centralize a lot of our data, and then streamline our operations in a way that allow us to focus more of our resources on the care provisioning side of the hospital. I think one of the other kind of key markers of this relationship has been breaking the barrier of the sort of CapEx OpEx problem that occurs in healthcare, that everything is encouraged to be a capital expense and operating expenses are sort of seen as more of a challenge. But by being able to shift that landscape and that understanding, we're actually able to free up capital dollars for investment in other healthcare specific ventures. In being able to tap into the relationship with Microsoft, we've also allowed our team to scale very lean. And what I mean by this is because of the support and training relationship that we have with Microsoft, we're not hiring as many resources as we would in the data space, say, a few years ago when you'd be provisioning all of these services individually versus the centralization that Fabric gives us. It also has allowed for us to extend our skills and our technology stack to partners in our area. So we're setting up regionalized data resources as well, and allowing them to avoid certain hires and focus their resources on care provisioning and capitalize on the assets that have already been developed through the partnership with Microsoft and PRHC.
I'm glad to hear about these markers, and the PRHC Microsoft partnership is clearly impactful. Could you share how this collaboration aligns with your vision for the future of digital healthcare?
I think that this partnership aligns perfectly with my vision for the future of healthcare, and specifically digitally enabled healthcare, because what it's allowing us to do is really create a more connected, efficient, and patient-centric healthcare system. And I think, as mentioned prior, the healthcare systems of old have to adapt. I think we're in a bit of an adapt or die era when it comes to provisioning and delivering strong patient care. This partnership aligns perfectly with that, because I think that as we start to move forward, we're going to see more and more of a requirement of not just interoperability, but true syncing of these different systems in real time as we look to optimize and make the best decisions possible in a healthcare setting. I think there's a lot of historically underutilized data in healthcare, as we all know. And I think one of the biggest areas of opportunity that this partnership has presented to us is more around the utilization of passive data. So our sensory data that's occurring in the hospital every day, and being able to collect and restream that in real time. For concepts like at PRHC, as an example, we're in the midst of deploying a command center where we can take all of these decentralized data points, centralize them for analysis, and then redeliver them to the decentralized areas where care occurs. One of the historical challenges has been we can't tap into that siloed data, and that because care occurs in this sort of desynchronized pattern, it's really hard from a centralized position to administer care. But through this relationship and partnership, we've provisioned a number of different technologies across the building that allow for us to interact with people in real time, to reinforce, discuss, and ultimately action decisions that are informed from a variety of different data sets that historically we not only didn't have access to, but we didn't even comprehend the potential impact that they could have on reevaluating what the future structure of our organization and healthcare larger can look like with these enablements in place.
Thank you so much for sharing these pointers and the importance of having technologies such as a command center or Fabric or the Azure AI and other solutions that you mentioned, such as security, of very importance, especially in Canadian healthcare. What advantages has the Microsoft ecosystem, such as these Fabric AI components, provided over other technology partners?
I think for us, it's really been the seamless integration. By having everything in one suite, looking at Fabric as an example, all the way through, having Data Factory for your ingestions, your orchestration, scheduling those jobs, moving its way through, the Synapse type solution where you're able to then do your data transformations and your analytics, and then ultimately provisioning data back to end users in ways that are intuitive and useful, whether it's via Power Apps or, Power BI in the use case examples that we would have here. It's allowed for us to do that all in one place, while also utilizing the Microsoft security stack and things like the governance components that, say, Purview brings to the table. To be able to provision all of our enterprise data solutions in one integrated stack is incredibly valuable. I think layering on top of that, the fact that all of the AI tools that we need to begin, from model training all the way through to delivery of insight can occur in one singular environment. It means that we're not setting up security groupings different times, that we're not setting up different infrastructure stacks and managing them asynchronously. We really are focused on one solidified solution that allows for us to be able to securely, reliably, and timely deliver, data products to our organization that help us not only make better decisions, but ultimately impact patient outcomes and lead to better patient outcomes.
Future looks very bright with the deployments that you've already made in place through this partnership. I'm also curious to know, looking ahead, how do you envision PRHC scaling its AI and digital capabilities to set new benchmarks in Canadian healthcare?
So for us, it really is about a call to action to the larger system. We're urging our peers wherever we can to adapt these technologies. It can be very intimidating at first, and most organizations, it's not just healthcare specific, starting that journey is very challenging. However, the earlier you start it and the more that you're able to invest your efforts in it upfront, the sooner that it bears fruit and the sooner you're in a position to actually utilize the data estate as it's intended to be utilized. So for us, in terms of the future, I think the benchmarks that we're looking to are things like pervasive analytics. We want to ultimately have it be part of our day-to-day decisioning without actually having to think about it. Some of the early day conversations in these types of programs involve prompting and asking people, did you consult data? Did you utilize a model to inform this decision? Did you reference a dashboard when you were going through your budgetary or allocation process? For us, it really needs to culturally shift to become a non-question and almost a guarantee that data is infused in all of the actions, decisions, and follow-up measures that we implement. I think some of the pieces that we're most excited about are being able to effectively measure and re-measure decisions that we make so that the next time we make them, we're informed and make that decision better. By not seeing the full picture before from a data perspective, it left us open to a lot of, what you would call sort of that gut feeling or intuition, which is certainly a part of that decision-making process. But by reinforcing it truly with data and specifically some of the outputs from the AI modeling in place, it really allows for us to be much more confident in our decisions. I think, again, in looking at beyond just the AI components, moving into low code and no code and being able to develop customized applications that can be deployed depending on the intended use case across the hospital without involving us bringing in large development teams to deliver it, has significantly expanded our capability to put data in front of people in ways that make sense, ways that they can understand and feel comfortable with the data, but then ultimately feel that the data is there to support them. In healthcare, data can have a somewhat punitive relationship with frontline staff historically, and that's not something at all that we're looking to recreate here at PRHC. We're really looking to make data an enabler of our frontline staff so that they're able to advocate for the supports that they need, and then administratively as an organization that we're administering our resources across the hospital in the most efficient manner possible.
I can't agree more with you, Evan, on those points. What excites you most about the next phase of innovation for PRHC, particularly with AI and other advanced Microsoft tools?
I think what excites me the most about it is that it provides significant opportunity to scale with what seems to be an impossible problem to solve. And by being able to provision this type of advanced care right here in our community, both Peterborough and the surrounding area, we're setting ourselves up that we can start to not only handle the volume of care requirement that's coming our way, but being able to start to get ahead of it and start to adaptively plan on what is increasingly a more acute patient population, what is increasing in terms of volume population, but also in terms of the demand. I think when we see communities continuously being strained from a care provisioning perspective, the only way out is through innovation. We can't, like I said, we can't buy our way out. We can't necessarily, build in a new system or solution. But through these adaptations and innovations in our partnership with Microsoft, we're setting ourselves up to be able to provision highly patient-centric care with excellent outcomes that's also scalable and sustainable. And I think, those are words that you typically apply to technology itself, but we're starting more and more to adapt their utilization to look at care. And how can we provide care with elasticity? How can we provide care that is scalable and maintainable over time? I think with tools like AI, it's starting to think more creatively about how to get ahead of problems before we're faced with them, really doing a lot less firefighting and focusing more on the strategic deployment of our care plans and pathways. By being able to take a more sort of consumer or patient-centric perspective to what that patient journey looks like in our institution, we're then able to ensure that patients have a better experience when they come to PRHC. When you're coming to a hospital, you're already in a bit of a challenging situation, not the most ideal setting. We're really looking to ensure that we make that as optimized as we can for our patients, while also factoring in what it's like for our clinicians to come to work every day and do their job. So What's exciting to me is that we, from the technology perspective, can meet the patients and clinicians and really look to optimize that experience for all involved parties. And then the larger kind of scale opportunity that this provides is hopefully setting a blueprint that can be evaluated for replication in different centers. By taking and centralizing all of these different services and solutions, we see this as highly scalable and repeatable to other sites. So the idea being that if we can optimize how technology provisioning occurs in the healthcare setting, we can consistently elevate the bar in healthcare for how patient care is delivered. And for us to be able to do that from where we sit is incredibly exciting.
Thank you so much, Evan, and appreciate your partnership with Microsoft. It's always wonderful to speak with you. I'm excited and I look forward to seeing the next stage of our collaboration.
Thank you so much. As always, really appreciate your time.